This is, as Ellen anticipated, a deep dive into one of our projects, which is the Support HCPs project. And the long-term objective that we have here is to enhance the ability of the different healthcare professionals to implement personalized medicine at the point of care effectively by addressing their challenges and their support needs. And so in order to reach this objective, we've started by mapping out how does the current, and if you go to the next slide, thank you, Vincent. How does the current healthcare pathway look like, especially for oncology patients, and how could the ideal pathway look like? And we've looked into what are the different phases that the patient would go into, and then what are the different steps within these phases that patients need to undergo within their care journey, starting from the screening up until the treatment is delivered. And so from this, then we understood that there are several HCPs that are involved in the precision medicine patient pathway, and we've started mapping them out. In the next slide, you can just see an example of how many different healthcare professionals interact within the pathway and in which phases are they interacting. And one thing that we understood through a literature review and through some of the initial conversations is that there is often unclarity on the roles that are played by the different team members within the healthcare professional team. And this fragmentation, of course, is impacting patient outcomes. And so we went a level deeper and we looked into each of these stakeholders, and still through publications and through initial conversations, we tried to in the healthcare pathway and what could their ideal role look like. So what is the potential of each of these stakeholders? How could they support in the end, again, to facilitate better patient outcomes and the access of patients to the right treatment at the right time? And through this journey, we realized there are two particular figures within the healthcare professionals teams that we could focus on, as they have an high potential to support other HCPs, and they're often not necessarily standardly involved within the pathway, which are the pathologists and the nurses. So we went again one level deeper, and we started to work on a deep dive to really understand what is the current and ideal role within each phase of the stakeholders, and what are the different challenges that they face. And I would like to hand it over to my colleague Silvia, that will walk you through an example of this deep dive.
Thank you so much, Ele. So indeed, this was a very interesting journey that allows to go deep in many different dimensions. And what we would like to do now is to just give you a flavor of the type of analysis that we did, because it's extensive and it would take us too long. So if we can go to the next slide. What we did, discussing with people in our network, so the nurses in our network, for example, but also the existing literature, was to look at the different barriers that are experienced by nurses, pathologists, and so on along the patient pathway. So to make a concrete example, when it comes to the testing step of the patient pathway, we looked at different types of barriers. So we know that education and awareness are just one of the potential barriers, but we know that there are many others that can potentially hinder the implementation of precision medicine at the point of care. For example, structural barrier, communication barriers, informational barriers. So we're trying to make sense of this very complex topic in this way. One of the things, to give you an example of the challenges of nurses when it comes to biomarker testing, is, for example, the need to address the communication barriers around precision medicine. So what we often hear from nurses is that there are many patients that go to them after they receive the results from their oncologist to ask for clarification and to receive, to have an opportunity to address this type of complex information in lay language. However, nurses do not always have the resources, or do not always receive the support to actually being able to do this. It's a complex task to be put in front of. And at the same time, along the same lines, is, for example, the limited role that nurses have in decision-making. So in many settings, nurses might still have recognized a small role in the care team, while they are often, as I was saying before, a very crucial healthcare provider in front of the patients. So this is an example of how we are trying to unveil the different types of barriers that nurses face. And as we were saying, we really did it from the screening until the testing the step of the patient pathway. And if you can move to the next slide, what we did next was then to look at for example, at the type of support needs. So from the challenges, we try to look at, okay, what are the support needs that are, ideally needed at each of the steps, and how is it the best practices are addressing these needs? So if I continue with the example I gave before, nurses somehow still, would need access to decision-making tools and lay language resources that can help to address these complex topics with patients. So we identified that this is a type of support need. And then what we did is to say, okay, what are there any type of initiatives that do something in this space? Can we identify best practices? So for example, when we looked at the best practices, we saw that, for example, the Oncology Nursing Society has a biomarker database that is a tool that has been designed with the nurses in mind. And the idea is to really help to basically provide the most important information about biomarker tests, and really helps to also both in terms of clinical decision making, but also to be able to answer some of the questions that patient receive. And we also saw that there is an initiative from CTTI, the Clinical Trials Transformation Initiative, that promotes the inclusion of nurses in clinical trials, which we know is also a very critical moment in step in precision medicine, and that provide guidance on how nurses can contribute. And basically what we did next, if you can click again, Vince, was to look at, okay, what is missing? So we know that we have identified support needs, we have identified best practices, but we also have identified potential area of gaps. So perhaps area where support is needed, but where we couldn't identify so far best practices. So for example, one of the things that we realized that in many settings there is still a gap in actually knowing how and integrating nurses in the clinical, in the core research team, and also in clinical decision making. So this is just to give you a little bit of a flavor of what we've been doing. And if we can move to the next slide. What was very exciting, Celia Diaz and also Silvia, who is in this call, was also like very active and supporting in the process. We've been trying to connect with nurses from many places in the world. Celia Diaz from Spain was able to present the findings of this initial analysis at ESMO that was just passed now in September in Barcelona. And now we're trying to keep connecting with nurses worldwide. So as you see, this is a little bit the reach that we've had so far, but also the reach that we might have in upcoming conversations in the next few months. And we see that there is a big appetite. We see that there is potentially an unmet need to be filled. So we will continue this conversation moving forward, both with nurses, but also with pathologists. Because so far they were identified as initial focus areas in the healthcare team. And if we can move to the next slide. This is a little bit where we are, but we know that, we started with this analysis, we connected with a lot of healthcare providers, but we know that there is a lot going on in the environment. So we would also love to hear from you. We are always eager to welcome new people to join these efforts. We're always also very eager to hear about best practices or other initiatives that are doing great work and that we can potentially connect with.